the special invitees from the non-governmental organization, the specialists, OBGYN, doctors in oncology and OBGYN from the Georgetown Public Hospital, members of the Presidential Commission and NCDs, special invitees from the Guyana Telephone and Telegraph Company, other senior functionaries of the Ministry of Health and other government ministries, members of the media, ladies and gentlemen, good morning once again. I also want to recognize our CMO, Dr. Narayan Singh. Forgive me for missing him. I've not seen him in a suit for a long time, so I miss you completely, sir. My apologies. Ladies and gentlemen, we are gathered here this morning for the launch of a very important matter that is core to the very development of our country and as a nation, and that is to work together on the elimination of cervical cancer, a very dreaded disease that has taken the lives of so many women, especially young women. And this is a national effort that is being made to champion the cause and to remove it once and for all. It is very pleasing to see that we have a wide participation from across government ministries. It speaks to the fact that we are not, as a health ministry, trying to do this alone. We have important partners, such as the diplomatic community, including PAHO, that has been playing a very important role. And so this morning, I want you to feel welcome, be welcome, as we participate in this session. You will hear more about the core issue that we are talking about today, and you will hear more about the strategy that is in place for us to get where we want to go from the speakers that will come during the program. But at this time, I would like you to help me welcome Dr. Dedele Paul, who is the coordinator of the Chronic Disease Unit, to make opening remarks.
Thank you, Mr. Gavaya. Good morning, everyone. Welcome to the Elimination of Cervical Cancer launch. According to WHO, cervical cancer is the fourth leading cancer in women globally. In Guyana, during the years, we have found that cervical cancer ranked among the top 3 cancers in women. And also for the year 2023, the Cancer Registry has reported that we had 126 cases. This is too much cases for that year. So as this disease is preventable and once detected early, it can be successfully be treated, but it continues to claim many lives. We would like to change this narrative. Today we have survivors in our midst who can give testimonial on the devastating effect of this disease and the resilience they have displayed to overcome same. We must not forget the lives lost. It's for them we are dedicating ourselves to this cause. The Ministry of Health has a screening program, which has been in existence for over a decade, but we have found that there isn't much uptake of these services. Therefore, we regrouped and formalized a new strategy. Today, we will be joining other countries that have introduced HPV screening in their public health system. This is a highly sensitive and effective test recommended by WHO as the screening test of choice, as it can accurately identify women at high risk of developing cervical cancer. This is an expensive test, but it will be made available to the public free of cost. Therefore, I hope we take advantage of this offer. Ministry will be aiming to reach the following targets by 2023. Vaccinate 90% of all girls against HPV by age 15, expand access to screening services for 70% of women, and ensure treatment for 90% of women with precancerous lesions. We can achieve these targets through education and by reducing barriers to accessing services, among others. In closing, we are kindly requesting that you tell a neighbor, a friend, a relative to visit their nearest health center so they can be screened and vaccinated as soon as possible. Thank you.
Thank you very much, Dr. Drepal. And I have heard some very important things there. And one that stands out is that this is a very expensive exercise. And the government of Guyana has decided to do it for the citizens. And so, on that note, I would want to join with Dr. Drepal to say, tell your neighbor, tell a friend, tell a relative, let's get to the nearest health facility to be screened. Thank you very much, Dr. Drepal. At this time, to give an overview of the Elimination of Cervical Cancer program in Guyana, I want to invite to the podium Dr. Lakshmi Lal, who is the Director of Non-Communicable Diseases and Mental Health Programs. Can you welcome Dr. Lal, please?
Pleasant good morning, everyone. Allow me to stand on the protocols established by our chair. Nevertheless, let me once again give you a pleasant welcome and good morning to everyone to the Ministry of Health's launch of the Plan of Action for the Elimination of Cervical Cancer in Guyana. What if we said to you that there was a simple test to tell if you are at risk of developing cervical cancer? What if we told you that this test takes no more than 2 minutes to perform and 2 minutes to read? What if we said that 2 minutes of screening will prevent a patient from having to spend countless hours, multiple consults, to seek services if she was diagnosed with cancer? Hours spent to see doctors, hours spent on chemotherapy sessions that will go for at least 4 to 6 months, and having to seek radiation therapy if chemotherapy fails, having to be subjected to surgery and chemoradiotherapy together. What if we introduced a test that was so simple you can take it home and perform it in the comfort of your home and bring the sample back to a healthcare worker? Wouldn't that be great news? What if we told you that a vaccine was available free of cost that can prevent all of this? Wouldn't you want to be counted as part of that process? Today I stand before you, proud to present Guyana's action plan for the elimination of cervical cancer 2024-2030. A plan that took all of these factors mentioned before into consideration. A plan that was designed not only to quickly screen and diagnose women, but to treat our women. A plan that was designed to ensure that more of our women survive cervical cancer and can continue to lead productive lives and contribute meaningfully to society. Collaborative effort is now needed between government, NGOs, and the private sector for the successful implementation and sustained progress towards achieving the goal of cervical cancer elimination in Guyana. This strategic plan is well-rounded and ambitious, with a multifaceted approach that has the potential to significantly reduce and eliminate the burden of disease and to improve the outcomes for Guyanese women. Our overarching goal is simple. By the year 2030, we aim to significantly reduce the mortality, morbidity, and disability caused by cervical cancer among Guyanese women. And it is comprised of 5 strategic clear lines. Firstly, this plan will see the ramping up of HPV vaccination programs throughout the country by increasing HPV vaccination coverage among the 9 to 15 age group to an impressive 90%. By vaccinating our young girls against the human papillomavirus, the primary cause for cervical cancer, we can prevent this disease at its very source. We're also further expanded this age group to include women between the ages of 16 to 45 years. Secondly, we pledge to expand screening efforts, ensuring that at least 70% of our women of reproductive age undergo screening twice between the ages of 21 and 65. Early detection is key to elimination. It will see the incorporation of HPV testing to all healthcare facilities, whether it is the accident and emergency rooms, chronic disease clinics, maternity clinics, and all outpatient clinics. If a woman shows up with a simple cough and cold, she can get an HPV test. To our women between the ages of 21 and 65, an HPV test should be added to your bucket list. For every woman having a conversation with her neighbor, her best friend, her peers, and staff at work, cervical cancer screening must become part of that conversation. To our very healthcare workers carrying out these activities, they themselves must first be screened. Thirdly, we're dedicated to treating 90% of all women with precancerous lesions and 90% of all women diagnosed with invasive cancer. Additional to surgical interventions and chemotherapy, for the first time, we will introduce public radiotherapy and brachytherapy services. Fourthly, we recognize the importance of improving the quality of life for women with end-stage disease. Up until this point, we looked at palliative care as end-of-life care. But this new plan will ensure a holistic approach to palliation and support services that are essential in providing comfort and dignity to those facing advanced disease. Finally, we understand the power of communication in raising awareness and driving behavior change. Our teachers play an equally important role. Our teachers will play an equally important role by incorporating into their daily teaching curriculums continuous education on the prevention of HPV infection and by promoting vaccination and later on screening. We will implement a comprehensive communication strategy that will extend to all modern social media platforms, reaching every corner of our nation with vital information on the prevention of cervical cancer. We wish to extend our sincere appreciation to our Honorable Minister of Health, Dr. Frank Anthony, for his exceptional leadership and guidance in developing this plan. To our Permanent Secretary, my apologies, he couldn't be here today with us, without whose support, none of this would be simply possible. You know what I mean. To our advisor to the Minister of Health, Dr. Leslie Ramsamley, I usually refer to him as the godfather of the ministry. We know that we can run any idea by him, and we can have him review anything that we would like, and he continuously provides that guidance for us. To our Obstetrics and Gynecology Department of the Georgetown Public Hospital, for their invaluable contributions to the development of a simple screening and treatment algorithm that will serve as the starting guideline for all healthcare workers across Guyana. Also to our medical physicists of the GPHC for our expert guidance in developing the outline for radiotherapy services. To the Ministry of Health and all of its committed staff, the Primary Healthcare Program, Regional Health Services, Laboratory Services, Standards and Technical Services Department, the Public Relations Team, the Cancer Registry, the National Surveillance Unit, and of course my team, the Chronic Disease Unit. I thank you for making all of this possible. I also wish to thank the Pan American Health Organization in Guyana for their invaluable insight in the development of this plan. PAHO's commitment to promoting health equity and improving access to quality healthcare has been a driving force behind our efforts to eliminate cervical cancer in Guyana. I'm deeply appreciative of your partnership and collaboration in this important endeavor. Let us unite in our determination to eliminate this dreadful disease from Guyana. Together, we can achieve our goal of saving lives and safeguarding the health and well-being of our women for generations to come. Thank you.
Thank you very much, Dr. Lal. Reducing mortality, morbidity, and disability that are caused by this disease is the aim. And so, thank you so much for giving that wonderful overview. There's a lot in store, a lot of work to be done, and as I am aware that the team at the Ministry of Health, we are ready to carry this fight so that our women can be saved from this dreaded disease. At this time, I would like to invite for an overview of the HPV vaccination program in the primary health care setting in Guyana. I would like to invite Dr. Ertanisa Hamilton, the Director of Family Health Program at the Ministry. Please welcome Dr. Hamilton.
Good morning, everyone. All protocols observed. Dr. Frank Anthony, the Minister of Health, Ms. Priya Manik Chan, the Minister of Education, the representative from the U.S. Embassy, Dr. Ram Sami, Chief Medical Officer, our representative from Mount Sinai, Dr. Singh, Ms. Karen Roberts, a representative from PAHO, colleagues all from the Ministry of Health, students, special invitees, members of the media. My task is very simple. I'm just going to speak a little bit about the HPV vaccine program and the context within primary health care. So, vaccination is actually one of the bedrock programs of health in Guyana. And it's probably one of the first programs that we know about, if we can recall in our memories. You had to go to the clinic for a vaccine. And so with the beginning of the health program, especially in the context of primary health care within our country, vaccination has always played a very important role. If we review our vaccination data over the years, we're going to see that the Under 5 vaccination program is a very good performing program in which we have our targets met of at least 90% and above, which according to the Pan American Health Organization and the World Health Organizations are the standards for vaccination. That therefore means that there are lots of diseases that we'll never see within our country because the vaccination program works very well. But then we came to HPV, and that's where the story got very interesting because we could not really understand what was preventing us from really getting the numbers that we desire. So Guyana received a donation of HPV quadrivalent vaccines in the year 2012. And that donation was, we started a pilot program for vaccinating girls who were 10 years old across the country. Not across the country. We selected 3 regions, regions 3, 4, and 9, and 6, as our first regions to start. And the results were very encouraging, especially for the first dose of the vaccine, in which the results were above 90%. But at that starting point, you had to take 3 vaccines at different periods. And we saw when it came to the second and third doses that the dropout rate for the vaccines were very high. But there were lots of things happening in the background, specifically as it relates to myths and misconceptions about the vaccines. So women became very concerned that their children may become infertile. They become very concerned about the fact that this was a new vaccine and there wasn't enough information. And so you saw that there was a greater effect of the anti-vaxxers working against the HPV vaccine. And that did not come at an opportune time because our country, as you look at the history of the cervical cancer, we had women who were affected, women who were dying. And in a lot of cases, because people were not very educated about it, people were not coming. And so the prevention that was intended with the HPV vaccine did not meet the target that we would have set. And then there was another problem. This vaccine was very expensive. And in 2012, paying $9 for one dose of vaccine, $9 for one dose of vaccine, would have been something that would have really affected the program, understanding that you were dealing with lots of children under 5 who had to get other vaccines at that point in time. And so there was a pause on the program. And then in 2016, Gavi, which is one of our partners for the introduction of new and underused vaccine, they approached the Ministry of Health in trying to get us a grant and approaching the manufacturers of the vaccine to give the ministry, through the revolving fund, a deal in which you would have been paying less for the vaccines. And Gavi, as one of the partners serving countries who were either low, middle income, or low income, they usually have a co-payment system in which you purchase your vaccines, paying for half, and they will pay for the other half. And so we began the process all over again. But this time, we recognized and we had some amount of information to work with. One of it, you knew what were the fears that were expressed by parents, why they were so afraid for their children to be vaccinated. And so for 2017 into 2018, we restarted this initiative with the help of Gavi, and we saw some reasonably good results with the girls at that point in time having at least about 50% of the girls receiving first and second dose of the vaccine. Then we got further, and then some of the challenges returned. But this time we had a new enemy. We had social media, in which you saw lots of stories, a lot of which were not true, being peddled once again, becoming a hurdle for the program in terms of having our girls receive their vaccines. But we were not yet at a place in which we would give up. COVID came and the vaccination for HPV was at a halt. And then in 2022, we restarted, slowly but surely. At this point in time, as an overall view of all of the girls between age 9 to 15, we're at 40% of coverage, which means that we have 60% more to go. This is not a number that we're very proud of, because we recognize that if we arrive at 90% of our vaccination, it means that we would have met at least one goal. And so these girls, when they become women, will be protected. After all, there are countries like New Zealand and others who are giving us numbers in years as to when they will eliminate cervical cancer, because they have the vaccination numbers, they have their screening done, and they have treatment. And so yes, cervical cancer can be eliminated if everything goes as it should go. And so we continue the program. When the vaccine was once 3 doses, we're now at a place in which every girl who is under the age of 16 will just receive 1 dose. When we started with only girls receiving vaccines, and I must say, in some countries, only girls are receiving vaccines, we now have both boys and girls receiving vaccines. When lots of countries are only going up to age 14, as would have been the recommendation, Guyana has extended this all the way to age 45 for women, because there is still a lot of coverage that can happen as long as you receive your vaccines. Just recently in 2022, a study was done that shows that to vaccinate one boy or girl in the country, we spend at least 17 US. And the 17 US includes the cost for the vaccine, the operational cost of persons to go and vaccinate. And I say that because in the coastline, you're going to see that the cost is minimal. But the teams never stop just going where it's easy. You will see our health workers with their carriers going as far as it takes them just to ensure that every child is vaccinated. And that is what makes the vaccination program important. That is what makes it valuable. The health workers do not stop at no. No means that we can go again. At least that's how it's interpreted. And that's the same force that is used on a yearly basis. And so this year we are going to restart again. And there's 3 modalities that we will be using for the vaccination program. We will be going in the schools to vaccinate. We will have vaccines available at the healthcare facilities, and we will be going to do outreaches in those far-off communities. That therefore means that there should be no girl between the age of 9 to 16 that is not vaccinated. And that means that every woman between that age from 20 to 45 has the opportunity to be vaccinated. And so I will join voices with my colleagues in saying that tell a neighbor, tell a friend, tell a relative, HPV vaccine is here and it saves lives. Thank you very much.
Thank you very much, Dr. Hamilton. And indeed, she underscored the point that the health workers are doing, or have been doing quite a lot, but we are only at 40% coverage. And therefore, we have quite a distance to cover. And as she would have pointed out, Gavi being a very important partner in this process, for which we are thankful. Speaking of partnership, we have in the room this morning a very important voice that will lend to this partnership. The fact that we need to also ensure that our girls are vaccinated and between the ages that have been prescribed, we need the partnership of the education department. And to make remarks today, we fortunately able to have our dear Honorable Priya Manik-Chan, the Minister of Education. Please welcome the Minister.
Thank you very much. Good morning to everyone. I'm not sure if I'm qualified to speak in a room full of doctors or survivors, all of you experts really on this issue, but I wasn't going to miss this for the world when I saw it. And I'm not a very good participant as an attendant at these things. But I believe this is one of the more important programs that we can launch. And I'm really pleased that we're bringing it back. I do remember, which ages me a little bit, the time we started in 2012 and how that went because of opinions and comments which we must always leave space for. We can't be building a country with tall buildings and shiny glass and smooth roads and bridges that take us to new countries and not look at our people. And so you have the right government in place, a government who is very people-centered and insists that the build-out of an infrastructurally good Guyana, a first world-type Guyana, must see all its people come along with that and benefit from it. But still, oftentimes, women's health and issues that are peculiar to women get left behind, not only here, but in countries around the world. And I think enough research and papers and articles and protests have been had highlighting the fact that some of the things that are peculiar to women don't get funded the same way. So I'm even more pleased that this issue, not peculiar to women, because Google says that boys and men are also affected, but disproportionately affecting women, that this country, with a male leader and a male minister of health, is pushing for the elimination of something that can be eliminated by vaccination. So you see, Frank, I don't always complain when you leave women behind. Every now and then men could get some credit. But it's serious and it's important because it was very easy not to focus on this. It's a small thing. People who get cervical cancer don't go on large protests and tell us that. They don't make it a sexy, attractive issue. They don't make it a political issue that politicians have to pay attention to. But here are politicians in your government proactively looking at how to make sure everybody in this country could move forward and thrive by making sure everybody stays healthy, including our girls and women. And so I'm really happy that that leadership is presenting itself in this form. Now, I am absolutely certain, unfortunately, that and the story that Dr. Hamilton just told was so reminiscent of the COVID vaccine. When we couldn't get it, we badly wanted it, and people died because we didn't have it. And then when we got it, we had our citizens who were entitled to those views taking the vaccine but still swaying people from taking it. So you had a lot of confusion there, lined up in the parliament collecting the vaccine and telling people it'll kill you. And so I expect we will get in this pushback, and I think it's the responsibility of every person in this room and every parent listening to us to make your own decisions about your children, your girls, because this is free, widely, or I shouldn't say widely, universally available across Guyana. Every region, every valley, every mountaintop, every inner city, community. It is available, it is free, and we're begging you to take it. There are going to be people who will tell you that, but I gotta fix the blackout first, or we need a house lot to make sure we can be comfortable after we can live. And they are taking the vaccine. And I'm saying these are some of the things we have to not get distracted by. This one here is a matter of life and death. It is a matter of life and death, and we're going to have to find ways not to force anyone, but to have everyone have all the information they are entitled to, so that we could take this not to 90%, but to 100%. We are fully committed at the Ministry of Education to help you roll this out with all the medical information that you will give to us and make it available to every school child. Guyana has the highest enrollment rate in our nursery school. This is not applicable to nursery children. We have universal primary education, so says the United Nations, which means that every child of primary age, 6 to 12, is in school or can access the school in this country. And so we have 100% access. And that cannot be wasted. And it must be used. And so I'm very happy to partner with Dr. Anthony so that the two ministries and the very hardworking staff, along with the private services, the private hospitals in the country, so that we could roll this out and eliminate something that can be eliminated. I mean, that is what, for me, this is a cancer we can get rid of. And I'm seeing way too many young people who are struggling with this horrible disease that they can't get rid of, and or that they're fighting. We could prevent that. We could prevent our girls that we birthed and loved and our boys from going through that struggle, and we should. Funnily enough, if I should make that confession, but I lost my daughter's clinic card a couple of years ago. It might be amongst documents that I'll find again at some point. But I called Dr. Hamilton to say, she's this age, at the time she was about 12, is there any vaccine due or anything I should be doing? She said no. HPV is the next vaccine, and then tetanus would be the next one at 15. And she's right where she needs to be for the HPV vaccine. And I can say that both my children will be taking this vaccine because I believe that that is something I can do to demonstrate the love I feel for them. And so, because I love all the other children of this country, I'll help you spread the message, Ministry of Health. I thank you and God bless you all.
For your open commitment to partnering with the health sector to make this a reality. Elimination of cervical cancer is possible, it's within our reach, and we can do it together. So thank you very much once again, Honorable Minister. Today we are very blessed and fortunate to have someone who can encourage us with a champion story. Miss Pauline Govaya from the Periwinkle Club, who is a cervical cancer survivor, is going to come to encourage us at this time. Can you let us all welcome Pauline?
I'm not such a great speaker, but I will try.
Yeah, go ahead.
I came here to share my story on cervical cancer. I was diagnosed, my name is Pauline Gavayo, right? I'm 62 years old. I'm here to tell my story about cervical cancer, which I survived 5 years now. And I went through the challenge and I faced it. And to be honest, when I first got the news from the doctor that I was diagnosed with stage 3B cervical cancer, I was a bit nervous at the moment, but I did not shed a tear. Most of the time, I used to think how to get over it. When I felt the pain, then is when I used to cry. I never even think about dying. Even though I used to hear cancer kills. As time goes by, I had to start treatment. I took 25 treatments of radiation and 2 cycles of chemotherapy and brachytherapy. Some days I will feel down. Some days I will feel up. It was a battle, a challenge, but I fought it with the help of God, with others that prayed for me, that was standing at my side. As time goes, I couldn't do the things I used to do. I was a very independent person, very active, traveling. Due to what I was going through, I had to give up those things. But in all of what I started to take, what started to take place, I did not give up. The other part of it, when I started to run out of finances, I had to take MRI, CT scans, ultrasounds. I had to turn to the Ministry of Health, the Periwinkle Club, and other organizations for help to get my treatment done. When everything come to a close and I was okay, I was so happy that I fought a good fight to be here today on this earthly plane. Finally, my encouragement to all women and young ladies, get tested early. Early detection saves lives. Remember, cancer is just a word, not a sentence. Early detection, you have a chance to live. On closing, I just want to say thanks to the Ministry of Health, the Periwinkle Club, and all other organizations, also the Giving Hope Foundation, for all the contributions. You have really made a difference, and I'm grateful for the help. I can't thank you enough for stepping in when I needed it the most. You will always remain my friend. Thank you so much.
You were probably too shocked to cry at the same time. But we can prevent that from happening to our girls and our women now if they follow the advice of Pauline and get screened, get tested, and be vaccinated very early. So thank you so much once again for sharing that very inspiring story with us here this morning. All right, I would just like to invite the director of the non-communicable diseases mental health program to do a presentation of the strategy to the Honorable Priya Manik-Chan at this point. Can you welcome Dr. Lal, and we welcome the Minister to have this presentation done. And so we thank you so much for participating this morning. Can we give her another round of applause? Continuing along the line of partnership, PAHO has been a tremendous support in helping us, not only in this context of the screening and care and treatment for persons with cervical cancer and prevention methods, but throughout the spectrum of health, they have been a partner. And today, representing the PWR is none other than Dr. Karen Roberts, who is going to make remarks now. Can you please welcome Dr. Roberts?
Thank you, Mr. Gavaya. Allow me to follow the protocol that the chairperson has established. Let me begin by saying that PAHO is happy to be associated with the launch of the National Strategy for the Elimination of Cervical Cancer. I want to join with Dr. Philippe Codina, the PAHO WHO representative in Guyana, as well as the wider organization, to congratulate the Ministry of Health on the launch of such an important strategic document. We all know that every year, cervical cancer continues to impact women, families, and communities around the world. And it is felt that there are few diseases that reflect global inequities as much as cancer of the cervix. According to the WHO, in low and middle income countries, the incidence of cervical cancer is nearly twice as high, and its death rates 3 times as high as in high and middle income countries. Proven and cost-effective measures for eliminating cervical cancer exist, but to date have not been widely implemented in regions of the world, including our region here, the Americas, where the disease burden is pretty high. The WHO's Global Strategy for Cervical Cancer Elimination, launched on 17 November 2020, laid out a clear path to eliminating the disease. The strategy defines elimination as reducing the number of new cases annually to 4 or fewer per 100,000 women, and sets 3 clear targets to be achieved by the year 2030. These targets include 90% of girls vaccinated with the HPV vaccine by age 15, 70% of women screened with a high quality test by ages 35 and 45, and lastly, 90% of women with cervical diseases receiving treatment. Today, PAHO applauds the Ministry of Health for developing its elimination strategy in alignment with these strategic priorities outlined by the World Health Organization. And to take it a little further, the Ministry of Health has used the recommended life course approach to ensure that lifetime benefits are maintained. To be optimally effective in its implementation, it's anticipated that the National Elimination Strategy for Cervical Cancer 2024 to 2030 will be scaled to regional levels and delivered using health services platforms that are sensitive to women's needs, their social circumstances, and their personal, cultural, social, and economic barriers hindering their access to health services. Effective implementation will also require coordinated cooperation among multi-sectoral partners. It will require broad support for equitable access in the context of universal health coverage. It will require effective resource mobilization, health system strengthening, and vigorous health promotion efforts at all levels. Having the opportunity to review the strategy, I know that the document demonstrates that clearing the path to cervical cancer elimination in Guyana requires bold strategic actions that are designed to improve community awareness, rapidly expand workforce capacity, strengthen health systems, shape the market so as to lower the prices of life-saving products, accelerate introduction of affordable technology into screening and treatment algorithms, and nationally scale up organized population-based prevention and treatment platforms. To ensure optimal effectiveness, it is important that the operational actions be developed and implemented in concert with frontline healthcare workers and providers, advocates, and women themselves. Cervical cancer survivors can serve as advocates, and we just had a good one, a good story just now. They can serve as advocates for ensuring and educating women and girls about the benefits of vaccination, screening and treatment, and for overcoming stigma and other effects. Today, PAHO is confident that the elimination of cervical cancer in Guyana is within reach, and takes this opportunity to renew its commitment to working with the Ministry of Health and other stakeholders for the successful and sustained implementation of this national strategy as the country seeks to eliminate cervical cancer by 2030. I thank you so much.
Thank you very much, Dr. Roberts. And I'm happy that you indicated as having the opportunity to review the strategy. You have seen the strength of it which include but not limited to the strengthening of the health system in the context of universal access. And I am happy that we are able to be guided by PAHO in this context so that we can achieve what is within our reach, which is the elimination of cervical cancer. So thank you very much once again. To just switch things up a little bit, I would like to invite to do an entertainment piece of hope and encouragement one Miss Umala Hall.
Good day, everyone. First of all, I'm Umayo, not Umalo. Yes. The clouds are gone, the sun is here again. I'm taking this moment, embracing its ways. This is a season of peace after pain. Troubles come, but don't despair. Keep pushing on, it will be there. Let go of all the worry and strife, and enjoy the joy of a new life. I'm in a season of peace after pain. The clouds are gone, the sun is here again. I'm taking this moment, embracing its grace. This is a season of peace after pain. I'm no longer burdened with my past. Darkness will wait for the light to last. So I'm living each day with no fear. In this season of peace, in this season of peace. The clouds are gone, the sun is here again. I'm taking this moment, embracing its grace. This is a season of peace after pain. Been through a storm, so much strife. Had to fight to keep alive. But now the rain has stopped, I'm here on dry land. Peace of mind is in my hands. I'm in a season of peace after pain. The clouds are gone, the sun is here again. I'm taking this moment, embracing its grace. This is a season of peace after pain. Season of peace, yeah. Thank you.
That's a beautiful, beautiful song, Season of Peace. And the fact that we can put such a strategy in place and work towards the elimination of cervical cancer, I'm sure that will bring a lot of peace to many families and to all of us as a nation. So thank you very much for that encouraging piece, Madam Omaya. All right, we are still in the mood, Minister, of partnership, and we have recognized that we cannot accomplish these big tasks by ourselves, and so we have quite a few partners in our midst today. But coming to make brief remarks is none other than Dr. Madhu Pandey Singh, the CEO of the Balwant Singh Hospital. Can you make her feel welcome, please?
Your Excellency, Minister of Health, distinguished members of the diplomatic community, Dr. Ramsamy, CMO, and all other distinguished guests. So as you all have heard this morning extensively about what the ministry is doing, and I must say it's really amazing, the goals that you have set, Minister, as leader of the Ministry of Health. But I'm sure you all would like to know what we are doing in the private sector. And in our lifetimes, we have been privileged to see the emergence of pap smear screening, colposcopy, and now prevention of cancer of the cervix with the human papillomavirus vaccine. At our hospital, we have built capacity by providing liquid pap with HPV co-testing, and now HPV testing is being advocated. I think they probably have a simpler method of doing it because they claim in a couple of minutes it could be done. But we have been offering that with the pap smears as HPV co-testing. We also provide immunohistochemistry, histopathology, and telepathology for the last year and a half. However, to target the at-risk group, the private sector's hands are tied, as this group is in the interior of Guyana, and we have to rely on the public sector and the Ministry of Health to really target that group. We do a lot of pap smears in the private sector, but our yield of positive cases is not as high as we could have once we can target that group. And we're willing to partner with the ministry if we have excess capacity and we could help with that, with reading the pap smears at least. The Ministry of Health, what is really remarkable is that the Ministry of Health has provided private hospitals like us with HPV vaccines at no cost. And we are implementing this in our pediatric immunization clinics, and we've had very good uptake. We had 30 doses in the last set that Dr. Hamilton made available to us. All were used, none were wasted. We have a new set of 50, and we are going to ensure that they are utilized. And this is highly appreciated by the private sector and is a giant leap towards eradication of cervical cancer. Who would have thought 20 or 30 years ago that we would see the day where we would have a vaccine for a cancer? We look forward to many more such public-private partnerships. And thank you once again, Minister and the Ministry. Thank you.
Thank you very much, Dr. Madhu Singh. We are very, very pleased to and delighted to hear how efficient you have been, as expected, utilizing the resources made available and the efforts that you are making and have been making in helping to the fight even before this this launch. So thank you so much, and we look forward for your continued partnership in this context. So thank you. At this point, I would like to invite to the podium to make brief remarks the head of department of the OBGYN at the Georgetown Public Hospital Corporation, Dr. Rafi Roseanne.
Honorable Minister of Health, Dr. Frank Anthony, CMO, Dr. Narayan Singh, CEO of Georgetown Public Hospital, Mr. Ravi Rambaran, DMPS of GPHC, Dr. Navin Rambaran, other dignitaries, my OBGYN colleagues, esteemed guests, and champions of women health. A pleasant good afternoon I think it's after 12 by now. Today, we gather here to embark on a monumental journey, a journey that holds the power to transform the lives of countless of women around the world, and more so here in Guyana now. It is with great honor and utmost pride that we unveil the launch of the global initiative of the elimination of cervical cancer. In this room, we are not just individuals, but rather a force united by a shared vision, a vision that transcends borders, cultures, and backgrounds. We believe in a future where no woman suffers from the burden of cervical cancer, where every woman has the opportunity to live a life of health, dignity, and fulfillment. The vision is not a mere dream. It is an achievable reality, and today it is pledged to make it so. Cervical cancer is a disease that has plagued the world far too long, a disease that we know is 100% preventable. It has caused immeasurable pain and suffering, but today Guyana stands tall as we are armed with knowledge, innovation, unwavering determination, resources, and a plan to eliminate cervical cancer. We refuse to accept the status quo. We refuse to let this silent killer claim more lives. We are here to declare war against cervical cancer, a war we will all win together. To the women who have fought courageously against this disease, your strength and resilience inspire us all. Today, we promise to honor your battle by dedicating ourselves to eradicating the root causes of cervical cancer. This program invests significantly in prevention, in education, and early detection, thereby ensuring that every woman has access to life-saving information and resources nationwide. But the fight does not end there. We recognize the importance of breaking down barriers that hinders women from seeking timely medical care. We will dismantle the walls of stigma, silence, and inequality. We will empower women with knowledge, empower them to take charge of their health, and empower them to demand the care they deserve. No longer shall cervical cancer be a silent enemy. We will make it a thing of the past. This journey requires collaboration, and we extend our hands to the Ministry of Health, to the government, the healthcare professionals, researchers, philanthropists, and all the communities nationwide. Let us join force, share our expertise, and pool our resources to create a comprehensive network of support. Let us leverage technology to reach the unreachable, to bridge gaps, and to ensure that no woman is left behind. Together, we will build a nation where cervical cancer is but a distant memory. Today, we celebrate the power of unity, the power of hope, and the power of a collective commitment as this program unfolds here in Guyana. We stand on the precipice of history, and it is our responsibility to seize this moment. Let us not be daunted by the challenges that lies ahead, but rather be inspired by the possibilities that awaits us. To the young girls who dream of a future free from fear, pain, and loss from cervical cancer, we promise you a nation where the shackles of cervical cancer no longer exist. Your dreams will not be shackled by the disease, for we will tear those chains apart piece by piece. Let us embark on this journey with hearts full of passion, souls of brimming with compassion, and minds ablaze with innovation. Let us become the architect of change, the guardians of women's health, and the bearers of hope. Together, we will eliminate cervical cancer. Together, we will make history. Let us rise as one, for the power to transform lives lies within us. Down with cervical cancer. Thank you.
It's a lot that we can actually aspire to do, and if we can get those done, we will get a very far way. So thank you very much. Thank you very much. I was so inspired. I mean, I don't know if to break dance, I don't know what to do, but you know, it is very good. Thank you. A force united on a shared vision, using the information available to us to our advantage to reduce stigma, silence, and inequality, to win the war against cervical cancer. That's what I heard, and that's powerful. Thank you very much. Put your hands together one more time for Dr. Roseanne. Mr. Rabi Ramiran has some good soldiers there. We got to check him out. All right. We want to add a little flavor, a little different spices today to the meeting. And so at this time, I would like to invite the Royalty Dance Ministries International to do a contemporary dance item.
The silence is in quiet, and it feels like it's getting hard to breathe. And I know you feel like dying, but I promise we would take the world to its feet. I'll bring it to its feet. I'll and I'll rise up, I'll rise like the day. I'll rise up, I'll rise unafraid. I'll rise up, and I'll do it 1,000 times again. In spite of the ache, I will rise 1,000 times again. And we'll rise up, I like the waves. We'll rise up, in spite of the ache. We'll rise up, and we'll do it 1,000 times again.
And at some point, I will have to visit my friend to let her teach me, because this is something I want to do as well. You know, some dancing. It's about the only thing that I don't know to do, and it's good exercise as well. And in saying that, I'm very pleased with the way in which the leadership team at the ministry is guiding the efforts that we're making every day to rise above the challenges that we have in providing care to the entire country. And at this time, I would like to invite a young man who is at the helm of the ministry, leading this charge, none other but the Honorable Dr. Frank Anthony, our Minister of Health.
Our friends from the US and the British governments who are here, Dr. Karen Roberts from PAHO, the various heads of the departments within the ministry, the technical experts, and our partners, Dr. Madhu Singh from Balwant Singh Hospital and other partners who are here, survivors of cancer. I think today it's a very important day for all of us. We have been talking about various types of cancer, but we have never really got together and done a very comprehensive program. And in discussing this in the ministry with various technical partners and so forth, we decided that for cervical cancer, we wanted to have a very comprehensive program, starting from prevention to treatment, and we should have that total continuum. And so what we are launching here today, it's that strategy, from prevention right up to treatment and treatment of complications. So if we start, one of the things that, as I sat there listening, I think all that had to be said was already said, but I just want to repeat some very key points. So if we start with prevention, we all know that HPV vaccination can help us to prevent cervical cancer. And while this was introduced around 2010 to 2011, we had various challenges, as was pointed out by Dr. Hamilton, in terms of the coverage of HPV vaccination. What we want to do now is to make sure that we increase that coverage so that we can get to 90% for girls between 9 to 15. But we also want to make sure that we target boys as well, because HPV can also affect boys, and we can see various types of cancers in boys, so we're not leaving them out. We also recognize with the new guidelines that CDC and other public health agencies would have advocated, that we can also give these vaccines for people between 16 and 25, for persons between 26 and 45. So while our primary focus is going to be on girls 9 to 15, any person who are in these categories, so boys between 9 and 15, we're also going to make the vaccines available. And for women, or girls between 16 and 25, and older age up to 45, we are also going to make sure that these vaccines are available. We need to come together to ensure that we fight off these myths and fake news that has been circulating about the vaccine. And I think once we can do that, we would see the percentages increase. So all of you who are in this room, we want you to help us to get that message out. And we have various pamphlets and so forth, videos and so that we've been doing that can aid in that communication process. But we really need everyone to help us to drive that message home. So if we do the vaccination well, we can actually prevent cervical cancer from happening. But we know that while we would aim to do this, we will also have persons, we'll need to screen persons. And again, our traditional way of screening was with VIA, and we did pap smears. But we are introducing now in the public sector HPV tests. And so this would be now widely available. As of next week, we'll be able to roll this out and make sure that anyone who meet the age qualifications, they'll have access to HPV testing. Again, we need to encourage people to get testing. You have heard from all the various persons who spoke the importance of this. And there are many studies that have been done. So if we screen people and we are able to detect abnormal cells early, then we can prevent many of the complications from happening, because then we'll be able to deal with it at a very early stage. But if we wait until people get all kinds of complications, of course it's going to be more difficult. So screening is absolutely important. And that is why we want to encourage every woman in Guyana to be screened. And it's not hard to do. We are going to make it as easy as possible. And so we'll be explaining this to people, how this test can be done. We'll be giving people the kits and so forth, so that we make it as simple and as easy as possible for everyone who wants to be screened. And then the third thing is that once we've been screening people, and our numbers there, we want to achieve 70% of persons screened. Of those persons that we screen, who we detect cancer, we want to make sure that 90% of them at least would have access to treatment. And therefore, treatment comes in different forms. In some cases, we'll be doing surgery. In other cases, they would require brachytherapy, for example. Right now, we don't have brachytherapy available in the country, but this is one of the commitments that we have made as a government, that will ensure that we can provide brachytherapy. So we're in the process right now. We've been talking to some partners like Mount Sinai to help us to design what that brachytherapy unit should look like, and what are the types of equipment that we'll need to have there. And once we get that, the types of information, then we'll put that in motion in terms of building a building, buying the equipment, setting this up, and making sure that we can offer those services in Guyana. Right now, for persons who need them, they either have to go to Suriname, some go to Trinidad, and you can imagine the inconvenience for those persons. So we want to make sure that that service is offered right here. So what we are looking at is the continuum from prevention right up to treatment. And we feel that if we implement using the WHO guidelines of 90, 70, 90, that by the time we get to 2030, that we'll certainly see a significant reduction in cervical cancer. As it is now, when we look at the stats from our cancer registry, breast cancer is number 1 among women, and cervical cancer is number 2. So if we can eliminate this, because this is caused by a virus, and if we can eliminate it, then this is one less thing we have to worry about. And with all the countries that have put strong programs in place, they have demonstrated that you can eliminate cervical cancer. And if other countries can do it, I think we in Guyana can do this as well. All we have to do is pool our resources, get ourselves together, and let's go out there and make sure that this is possible. So we have developed this strategy. It's there, it's all written out, it's all well thought out. Now what we need to do is take what we have in the strategy and start implementing it, and implementing it at scale. And I think once we're able to do that, we can come back here maybe in a year's time, 2 years' time, and assess how far we would have progressed. And I think that is what is important. So to all our partners and everyone who is here, I want to thank you for all the good work that you've done in helping us to put this document together. Now, the next set of tasks really is going to be implementing what we have in the document. And once we can accomplish that, I think we can all be able to celebrate when we see those numbers for cervical cancer dropping, and when we see the coverage for HPV going up. So let's all work together and make this happen. Thank you very much.
Thank you very much, Minister, for those encouraging words. I hear about togetherness, unity, and partnership for a strong implementation. It is the only way that we're going to get it done, if we come together and we do this together. So thank you for charging us to get this on the road, because we can have very well, as you have indicated, we can very well have a good strategy, but if there's no implementation, then it's a strategy on the shelf. And we cannot afford to do that. The cost is too high. I would like to invite again the Minister to hand over the strategy to some of our partners. And I would like to also invite the Deputy Head of Mission of the U.S. Embassy here in Guyana. I would like to invite the Deputy British High Commissioner. I would like to invite the CEO of the Balwant Singh Hospital, all to receive a copy of the strategy so that we can be able to work on this together in eliminating cervical cancer. The CEO of the Georgetown Public Hospital. Come on, Robbie. Thank you very much. Thank you very much, Minister.